The access to quality health services remains a major challenge for many young people and vulnerable communities in Eastern Uganda. In the districts of Kumi and Mbale, barriers such as stigma, limited sexual and reproductive health information, inadequate youth representation in health decision-making structures, and long distances to health facilities continue to affect service delivery.
We don't have enough budgets to cater for some of the needs that the youth are having. For example, having outreaches to reach out to them and provision of quality services. So we have a limited budget. We don't have enough youth-friendly corners where the youth can easily come and get the services.
In terms of coverage, Kumi is a big district with 140 parishes, translated to almost about 193 villages. The number of youth who have reached so far may not be really very big.
Young people, they always have challenges when it comes to access to services, and some of the reason why is about the friendliness of the service. If a young person comes to get a service and maybe the person giving them a service is not friendly, or maybe the service they want is not available at that particular date, this young person will not come back at the facility.
Amidst these challenges, organizations such as Mbale Network of Young People Living with HIV are working with communities and local governments to strengthen youth inclusion and improve health service delivery.
It was very hard bringing them to sit in the committee. We had to explain to them, number one, why are you supposed to sit in this committee? What impact is it bringing? Not only to the community, but raising your voice out there, even to the facility that we are serving in. So we had to open their minds to bridge the gap and tell them, we really need you to sit here and this is what you're going to do. So at some point, it was a very big challenge.
This is a story of the journey towards better health services in Kumi and Mbale. For years, many young people in Kumi lacked information about their sexual and reproductive health rights. Limited awareness about available services, coupled with fear and stigma, discouraged many from seeking medical attention. Apio Caroline, the Kumi District Secretary for Social Services, says this has affected the well-being of many adolescents and young adults.
The youth survive maybe on condoms, but you find stockouts every now and then. They are there, they are not there. And imagine the life of a youth without a condom, without a family planning, result them into doing or into sudden happenings like contracting the HIVs, getting pregnant. And as a district, we've gotten knowledge and we are really going to fight this, and we make sure that these people are catered for.
Young people themselves say there is still a need for more awareness campaigns, mentorship, and capacity building initiatives to improve access to services such as family planning and HIV counseling.
There should be some other practices that should be put in place to meet the demands of the youth. For example, we've seen the escalating rates and the prevalence of teenage pregnancies. Therefore, family planning should be introduced into these health facilities to mitigate this.
Especially when it comes to HTS services like HIV testing services, when you want to get counseling from the nurses.
The continued health challenges in Kumi and Mbale attracted the intervention of Mbale Network of Young People Living with HIV and Youth Advocacy for Decision-Making Action through the YADA project. The initiative focuses on increasing youth participation in health service delivery and promoting inclusive decision-making structures within health facilities. One of the major areas of focus has been the implementation of the 2019 Ministry of Health HUMC unit. Reproductive, the MNYPA Executive Director, also the YADA Project Coordinator, says involving young people in budget advocacy and accountability structures creates opportunities for them to influence decisions affecting their health and well-being.
A Health Unit Management Committee guideline that speaks that every facility must have a youth representative on the committee. But on ground, we did a baseline survey in Kumi and Mbale, and Kumi had no young person on the HUMC committee.
In Kumi district, local implementing partners say the introduction of the Health Unit Management Committee guidelines initially faced resistance and slow adoption, but with continued engagement and sensitization, stakeholders gradually embraced the initiative.
We realize that their term is ending and they will have to elect a new committee to sit, which is going to consist of now implementing the 219 guidelines of a young person sitting in this room. So we brought them in together and we aired out how are we going to help each other, to hear from the leaders who have been sitting in these committees and also to a young person that is supposed now to sit in this committee.
Today, many young people are increasingly participating in health governance structures and are more aware of their rights to quality healthcare services.
Realizing that now the guidelines have been put out there and a young person is now sitting on the table. We are looking at like a tutor. We have evidence that we have a young person sitting on the table in these committees, and we see that it is bridging the gap that we had at the community level and also at the facility of how service delivery is reaching down to the people, to the young people.
According to YADA officials, youth inclusion in health services has steadily increased over the course of the project.
The move we started of having youth represented is really working, and I say that one is really outstanding because most of the youth are now sitting on different committees like the DAC, like the HUMC. They are really engaged.
Despite the challenges, health officials say youth involvement in health management structures is already contributing positively towards service improvement.
Involvement of the youth in general has helped to drum up the uptake of services. And drumming up the uptake is two-way. One, by ensuring that the youth themselves get the information. The youth themselves are able to share with them the challenges that they have.
Youth leaders argue that the current funding levels are insufficient to actively address the HIV burden in the district.
The local government of Mbale has allocated the 0.1% towards HIV. We appreciate that it can cater for needs for young people in HIV, but it's really not enough for us to continue with advocating for the needs that young people are facing in their communities.
We're still facing challenges of young people getting new infections. This is just because of the sensitization, which is still low. Meaning the DHE, the District Health Education Team, will not be able to sensitize the community about the HIV issues.
The 0.1% of our budget is 33 million in a financial year, but the much we can access is just like 20% of that allocation or that draft budget which we would expect it to come to the HIV response. So I feel because of different local resource base, we feel that for the response to be uniform, then we would wish that the government deliberately allocates a grant.
Mbale District Planner Wanyale Abdallah Magumu believes that independent and sustainable financing mechanisms are necessary if HIV interventions are to achieve long-term success.
You must have an independent budget for HIV. But if you don't have, then you are saying other people should do it for you better. You must have it. Because you have those youth corners at facilities. But how do you fail to have a budget? If you must visit and see what the youth corners are they doing well, what do you use? So there should be a section in your work plan, HIV, like there is for malaria.
As Uganda continues to fight against HIV, AIDS, and other health challenges, leaders and stakeholders believe that empowering young people to participate in health governance is key to transforming communities. Organizations such as Mbale Network of Young People Living with HIV remain hopeful that stronger collaboration between government, civil society organizations, health workers, and communities will improve health service delivery, a future where young people are no longer left behind